The difference being that we have the benefit of having the highest rate of double vaccinations in the country, and we are working our way through boosters as well. We are expecting to have roughly 65,000 booster doses administered by the end of the day today. Given our dramatic rise in cases, there's still no one in hospital. And hospitalizations and ICU admissions are a critical metric in tracing this forward. One of the reasons behind that no one is in hospital, of course, is the work you have all done to date and the fact that vaccines are working. They are doing what they should. But please remember that vaccines are not a cure, but they are our best line of defense. And they're doing exactly what they are supposed to do. Yes, infection is still possible, but the impact is mitigated. I know that that is some small comfort and not any reason whatsoever that we should drop our guard against COVID-19. Because it's not just the vaccines at work, it's also our collective vigilance as we follow the robust public health guidelines. You know the drill by now, and I'm sure you're sick of us saying it. Wear a mask, wash your hands, keep your distance, keep your contacts low, stay home if you're sick, and arrange a test if you have symptoms. Please do not get together for big gatherings on New Year's Eve this year. You can significantly help us reduce the spread of Omicron in our province by not gathering at parties, in a house, or in a shed. Book your booster if you haven't already done so. And please be patient and kind. Please know that we are pushing information out as soon as we get it. But unfortunately, we cannot control the spread of rumor. Rumor often comes from a place of worry, but it often doesn't help. So if you hear something, ask the person saying it if they heard that from Dr. Fitzgerald or read it on the province's COVID-19 website. If not, do not play a part in spreading it. There is no COVID cure at this moment, so we must come to terms with how we live with the virus. And how we do that, my friends, is up to all of us. I know many sacrifices have been made, and I wish I could tell you that more are not needed. Which is why we are here today to announce that schools will be going virtual in January. On January 4th, they will be going virtual, and we will be evaluated on a week-to-week basis. Now is the time for precaution, not for panic. Remember, we all stand behind that wall of defense together. And with that, I'll turn things over to Dr. Fitzgerald for today's update. Dr. Fitzgerald.
Thank you, Premier. Thank you all for joining us today. I hope you all had a Merry Christmas despite changes and what was happening. So since the last public update yesterday, we have 312 new confirmed cases of COVID-19 in the province. 216 of these cases are in Eastern Health, 49 are in Central, 30 are in Western, and 16 cases are confirmed in Labrador-Grenville Health. There is also one case tested through a private laboratory, and the region has not been confirmed at this time. There have been 44 new recoveries, leaving 1,111 active cases in the province. And there are no hospitalizations as a result of COVID-19. 3,018 tests were completed yesterday, with over 385,000 tests completed to date. For those in Labrador, I know you are concerned about the increases in cases that you've seen over the past few days. This is more cases than you've seen before, indeed at any point through the pandemic, but it is not unexpected with such a transmissible variant as we have right now. Remember that you all have it in your power to reduce the spread, and you have the ability to keep yourself and your family safe. And this goes for everyone across the province. Please stay home as much as possible. Stick with your consistent group of contacts. Limit your contacts outside of this group as much as you can, and follow public health guidance. I have the utmost confidence in public health officials in Labrador. They are very good at what they do, and they are prepared to respond to the outbreak. And I am aware that there's been much public speculation about changing the provincial alert level. We will not change at this time. The cases we are reporting this week are the result of transmission that took place just prior to and during Christmas, and we are monitoring severity indicators such as hospitalizations very closely. And if we start to see increases, then we'll certainly revisit that decision. The last thing really that anyone wants is another lockdown, and we're trying to strike a balance between reducing spread and allowing people to engage in activities for their well-being. The restrictions that we have in place are targeted at the highest risk settings for widespread transmission, but this does not mean what is permitted is altogether without risk. So any activity where you are in close proximity to another person without a mask carries a higher personal level of risk, regardless of whether you're going for a small gathering at a friend's home or training on a team. Everybody has to make a personal decision about their level of risk and what they are willing to accept for themselves and their family. As I said, no one is hospitalized as a result of COVID-19 at this time, and we continue to closely monitor the hospitalization trends in other jurisdictions that are further along in their outbreaks than we are. And it appears that severe illness may lag behind a surge in cases by a week or more, so we continue to tread carefully. I want to remind travelers that anyone aged 5 and older entering the province is required to use their rapid test each day for 5 days and can only leave isolation if the 5 rapid tests are negative. We are hearing reports of some travelers that are not using the tests as required. To be effective, they need to be used each day, and you are legally required to do so. I know that there is a lot of public discourse on the availability and use of rapid tests in the community. In our province, rapid tests are used during outbreaks and cluster investigation, and on the diagnosis of cases where lab-based PCR is not readily accessible, allowing for improved turnaround times for test results and more rapid identification cases and contacts. There are a variety of rapid tests, and they are not all equal in their ability to detect COVID-19, depending on when they are taken in the infectious period. And we are looking at several key areas for deployment of rapid tests to most effectively reduce the risk of spread for those most vulnerable. And at this time, it's not recommended that we use them for general use in the community. With hundreds of new cases daily, public health has had to make changes to case and contact management in an effort to expedite notification. First, the test results portal now will include positive test results. If you see that your test is positive, self-isolate and wait for a call from public health with further instructions. Second, anyone that tests positive will be asked to notify their close contacts as far back as 72 hours before their symptoms started. They will be given a letter to send to these individuals with detailed instructions on self-isolation and testing requirements. We know that our best defense against Omicron is speed, and this is the quickest and most efficient way for us to notify contacts and get them into isolation. That's the most important thing we can do. If you have even one symptom, isolate immediately and book a test. Do not assume it is a cold. It is impossible to distinguish between COVID and a head cold without a PCR test. Until you get a negative result on a PCR test and your symptoms have resolved, do not attend or host a gathering or enter public establishment. Visitors should not enter a home where someone is isolating for any reason. I also encourage everyone to pare down their plans for New Year's Eve and keep their close contacts to their steady 20 only. Remember that you should not bring together people who are not in each other's steady 20. If you may have been exposed to COVID-19, if you are isolating or symptomatic, do not attend a gathering. Barring on any unexpected developments, this will be our last briefing for the year, and I hope as we close the book on 2021 that there will be brighter days ahead for all of us in 2022. Until then, hold fast, Newfoundland and Labrador. Take care. Thank you.
Well, thank you, Dr. Fitzgerald. Some wise comments there that we can all partake in as we go towards New Year's Eve. Keep the gatherings low, as we both said. I'll now turn things over to Minister Haggie for some brief comments. Dr. Haggie.
Thank you very much, Premier. Obviously, with over 1,000 active cases today, everyone's concerned, rightly so. However, the important number is 0. That is the number of people we currently have in hospital as a direct result of COVID-19. The risk of hospitalization, the biggest reduction in that risk comes from being fully vaccinated, as nearly 92% of our population are. That reduces your risk of hospitalization by a factor of up to 60. A booster shot will further reduce that by a factor of about 5. We are well positioned to avoid straining our hospital resources. But as Dr. Fitzgerald says, we really need to be wary and see how things play out over the next week or so. I'm going to address a couple of areas. One is long-term care, and you can recall back in March of 2020, we took prompt action to protect those most vulnerable citizens. So due to the increase in number of cases in the province, we're going to introduce some additional restrictions on acute care and long-term care facilities. This will also include personal care homes and community care homes where they exist in Eastern. For the next 2 weeks, visiting will be limited to one designated essential person. The designation of essential is one made by the care team in conjunction with the family and required for physical or emotional support. They'll provide assistance with mobility and these kind of things. It is unfortunate we have to do this at the holiday season, but our prime concern has to be the safety of residents within these facilities. There will, however, be no change to the current relaxations, adaptations for end-of-life visitation or for support for obstetric patients. In addition to visitor restrictions, there will be no more day passes from facilities for the next 2 weeks, except in the most extenuating of circumstances. These measures will be reassessed in a fortnight's time, depending on the epidemiology. We may be able to change them and we may not. We'll have these detailed restrictions up on the website by the end of the day. We've seen a significant increase in demand for testing, and we're working actively with the regional health authorities at the moment to bring testing clinics into rural areas of the province. Currently, they tend to be concentrated in the most populous areas, and that's really been because of the nature of the holiday period over the last 4 days. In Labrador specifically, there have been concerns. We have rapid testing ID now, which is a PCR-based test in each of the coastal clinics. They have and are being resupplied with testing kits today. Nain got very low yesterday, but had been able to complete all the testing that was required. They'll be getting another 240 kits, probably already have them by now, for the PCR, as well as 75 ID now. Natuashish is getting another 100 PCR kits and 50 rapid ID now. There are 10,000 more PCR kits going into Happy Valley Goose Bay for onward distribution, and 360 gene expert kits. The supply is there. Weather permitting, we will be distributing them as rapidly and as needed. These tests do expire, so it's important that we use them prudently. Vaccine, we've had an excellent uptake with vaccine, and I'd like to take this opportunity to thank the media who have taken the time over the holiday period to transmit on our government and RHA appointments and bulletins. It's been very helpful, and it's seen a huge surge in demand. And in actual fact, unfortunately, as the clinics fill, they disappear. They are being repainted, as the RHA say, particularly now as the holiday break eases a little bit. There is no shortage of supply, and indeed we have another 100,000 doses of Moderna coming tomorrow, which will translate into more shots in arms. Just a word about 811. If you need a COVID test, use the online tool. 811 doesn't actually book appointments for you. It uses that tool on your behalf. It's simply a person at a keyboard to do it on your behalf. Your testing appointment is not in any way prioritized any differently if you go through 811 or if you go through the online portal directly. It also cannot provide you with your test results. Those are available at the online portal. And as of today, you can also now view positive tests through that portal too. The information on isolation requirements Dr. Fitzgerald has referred to. I supply that to try and deal with some of the rumor the Premier alluded to earlier. Again, I just close by reiterating Dr. Fitzgerald's comment that this may not be, and certainly really isn't the time, to have a really good big shed party on New Year's Eve. It will not serve any of us well, and it will certainly not serve your friends who might otherwise come to that. They may want to drink with you at Christmas and New Year, but they don't need COVID too. So with that, stay safe, and we'll make the best of this year. 2021 was better than 2020, and 2022 will be better still. Thank you, Premier.
Well, thank you, Minister. I'll now invite some comments about the schools from Minister Osborne. I'm sure there's many parents and families anxiously awaiting, not the news we want to be delivering. I know my children are not happy about me having to deliver this news, but go ahead, Minister Osborne.
Thank you, Premier, and good afternoon, everybody. I'm here this afternoon to advise that next week classes will start on January 4th as scheduled, but in an online learning or virtual format. Our priority remains getting students back in person in class as soon as it is safe to do so. And so we'll be evaluating the status every week. As part of this, an update will be provided to the school community each Thursday starting on January 6th regarding how the following week will look. With the recent news of the COVID-19 Omicron variant in Newfoundland and Labrador, some changes to our approach were required. Obviously, this is a significant shift in our school communities. And while we experienced the shift from in-class learning to virtual last year, I know that it's not ideal, and I appreciate everybody's patience. We fully anticipate that there will be some bumps in the road in the new year. However, this is the eventuality that we prepared for in the final 2 days before Christmas break. So it is our hope that educators are ready to hit the ground running on January 4th for online learning. I know the NLTA has indicated support for online learning to start the new year, and we appreciate that. As we undertake this shift, a few reminders. The ability to deliver online learning is not dependent on Chromebooks for our K-12, our K-6 students, and Chromebook purchases last year were specifically for grades 7 through 12. For our younger students, most personal laptops, tablets, desktop computers, or smartphones can be used for online learning. And most personal devices that families have available in their homes can be used for accessing online learning. All schools worked last year to determine if there were students in their school communities that did not have personal devices and that work for online learning. They worked with those families, and we asked those families, we asked them last week to refresh that list. We expect every student in the region will have access to the necessary technology for online learning, especially the 7 to 12, but for K-6, if there is a family who does not have access to a device, we ask you to contact your administrator, and we will work with you to ensure that that device is provided. While we have previously asked families to provide that information regarding their children, we want to ensure that no student is left without. So therefore, again, just a reminder, any family who does not have a device in our K-6 system, contact your administrator. We'll make sure that you have one. In closing, I want to encourage all families of children aged 5 to 11 who were recently approved for vaccines to keep your appointments and to start your vaccination regime. The future beyond this is bright. It doesn't seem like that way today. We all have COVID fatigue. Believe me, I'm looking forward to seeing this in the rearview mirror. But the future is dependent on strong vaccination. And we ask everybody, especially those ages 5 to 12 who haven't yet received their vaccination, to make sure you set up an appointment. Thank you. And as Dr. Fitzgerald says, hold fast.
Oh, thank you, Minister. Thank you for delivering that news. I can tell you there's some sad children in my house today, and as I'm sure there are across the province, but it's the right move for the right time, and we will be reevaluating this regularly. So please just bear with us as we navigate the situation. I do agree with Minister Osborne that there is reason for optimism, and of course, we're not in the same position as we were in March 2020. There are many measures that we know work, including vaccines, and we're leading the country, if not the world, on that. So with that, I'll open it up now to questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters joining us today. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Richard Duggan with VOCM. Please go ahead.
Thank you, Dr. Fitzgerald. Where are the major outbreak sites in the province right now, and what types of activities are they linked to?
So I'm not sure I can narrow that down for you, Richard. We're seeing outbreaks pretty well across the province. A lot in the eastern region were associated with downtown establishments, bars and restaurants, and and certainly personal gatherings, a big one as well. The outbreaks are the personal gatherings certainly we're seeing across the province as being a trigger for outbreaks, and some sporting teams as well. So there's been it's quite varied. The information that we're getting now with such a large number of cases and contacts, the information that we're getting about sources is, as you can imagine, a little more difficult to pin down. And as we get into more widespread community transmission, that information becomes more difficult to get. So it's suffice to say that, gatherings certainly are a big contributing factor, and that's why we're asking people to limit your contacts as much as possible.
And what is the availability of the Pfizer vaccine right now? We're hearing from dozens of people who say they can't book their Pfizer booster or for their second shots for children. Why is that, and when will people be able to book those appointments?
Before I turn it over to Minister Haggie, people really shouldn't be brand shopping for vaccines. We've said that the whole time. I mean, there are certain restrictions with respect to age groups, but otherwise, a vaccine is a vaccine, and you should take the first available. Minister Haggie?
Thank you, Premier. We had 46,000 doses of Pfizer on hand. They are being reserved for, the adult doses being reserved for those people 18 to 29, preferentially. If you're not in that group, then you will not be offered it. You will be offered Moderna, and Moderna as a booster at half the dose of the second shot is, according to some, well, it's certainly no disadvantage, and may actually give you better protection as a third dose, as a booster, not as a primary series, than using Pfizer. So Pfizer is being reserved for that age group.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi, good afternoon. It appears there are still frontline healthcare workers who are having to compete with the general public for boosters. Are there any plans to remedy this?
Before I turn it over to Minister Haggie, my understanding was they've been in the hospitals doing similar to flu vaccine campaigns in which they go ward to ward to make sure they're tackling as many healthcare workers as they can. And my understanding that is that's going to continue, but you go ahead, Minister Haggie.
Yes, we do have the approach you've described there, Premier. We also have, the conference room down in, for example, James Payton can be used for a general vaccine clinic for healthcare workers. We have, as of close of business Monday, where somewhere just over 10,000 frontline healthcare workers vaccinated with their third dose. Based on the figures that we have in the past, that's certainly of the order of 30% for that group, which is significantly higher than the general population. So they are a priority group.
Thank you. And perhaps Dr. Fitzgerald can answer this. The US is apparently going through a surge in severe cases in children. And I'm wondering whether you feel that's a bad sign in terms of Omicron, or is it more a case of low vaccine numbers?
So that's it's not as clear-cut a question to answer, really. So, it may just be sheer numbers that are doing that. If we're seeing lots of cases in that age group, eventually you will see a certain proportion of those cases with severe outcomes. That's just how it works. But so it could be related to that, or it certainly could be related to vaccination uptake. So I don't think the analysis really has been done on that at this point. So it's difficult to give a definitive answer there.
Our next questions are from Patrick Butler with Radio Canada. Patrick, please go ahead.
Hello. My first question is with regards to one of the units of the Health Science Center where all visitation has been suspended. It's Unit 5 South B. Eastern Health put out a notice about it last night. Is there an outbreak right now at the Health Sciences? If so, how many people are affected, and what has been the impact on services there?
Minister, that's probably best for you.
Yeah, sorry, I'm experiencing some technical difficulties here, Premier. My PC has frozen.
Get a Mac. See, that's the answer.
No, this is the work one in the office. This is contacts. We have significant number of healthcare workers who have become contacts and who have been required to isolate. We have incomplete data because the data that the system that's used to collect that data was damaged and is still offline from the IT outage earlier this year. The figure I have at the moment is we have 487 healthcare workers currently isolating, and that's a low estimate. I would suspect that that is the issue. Obviously, I can't speak to specific, personal health information.
So this is not as a result of an outbreak; it's as a result of a staffing shortage. And is this the only area of the health system where we see the sheer amount of health workers isolating having an impact?
I think you're misquoting me there, Patrick. It's not as a result of staffing shortages. The visitor restriction is a public health measure to safeguard visitors and staff as well as patients. The issue is this happens from time to time where you do get staff exposed and potential exposure of patients. The recommendations from Infection Prevention and Control are specific to any given incident and have resulted in.
I think we lost you there, Minister, or is it just me?
No, I think we did.
Patrick, I think what what Minister Haggie was trying to finish with was that each hospital has their IPAC team, and they make evaluations on individual situations for the safety of staff and patients alike, and it would not be abnormal to have precautions in place as it pertains to specific situations. With respect to I think you said 5 South B. Certainly we can get details for that as they become more available from the IPAC team.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, thank you. My first question is, are there enough COVID test kits in Northern Labrador right now? And how concerning is the growing number of cases?
I'm assuming we don't have the minister again, but as the minister said in his comments at the outset, Ben, we are shipping more test kits to Labrador, a healthy number that should meet the demand. I spoke with President Lamp last night, for example, about the volume that they would need, and my understanding is that that's already en route for them, and we are confident that we can continue to supply that level of testing that is needed. Of course, there's always weather issues, but weather aside, we're confident in the supply chain ensuring that Labrador is kept safe. Minister, was that you just rejoining?
Hopefully, yes, Premier. It is. From the point of view of test kits, there are adequate numbers. They ran out of. They were in the process of running low on both PCR and rapid ID now. They completed their testing the day before, and we have since been able to resupply them with the numbers that I gave in the preliminary comments.
10,000, I believe, Minister, was the number correct?
10,000 have gone to Labrador. Grenfell named specifically had a slightly lower number pertinent to their particular population. They had 240 kits delivered over the course of yesterday and today, and 75 ABBA ID now.
Thank you. And there were a lot of rumors circulating this week of potential alert level changes if they were going to happen, if they weren't. What exactly would it take to change the alert level in the province right now?
Well, first of all, this is part of the reason to have a briefing today is to reassure people that you can't go by rumors, you can't go by social media. You can only go by what Dr. Fitzgerald and her team say and what our website says as the guidance. So rumors are just that, they're just rumors. And I'm sure some of them are well-intentioned even, but we're always looking at the epi, the local epi, the hospitalizations and the ICU capacity, and really the projections based on other jurisdictions across the country and around the world to see how we can extrapolate predictions from their jurisdictions into the hospital capacity and ICU capacity within our own province. Go ahead, Dr. Fitzgerald, sorry.
Thanks. Yeah, so we're very closely watching severity indicators, which would be hospitalizations and ICU admissions. We're watching what's happening elsewhere in the country, as well as what's happening here. And certainly it's a little bit difficult at this time because some of the hospitalization data that we're seeing is actually as a result of Delta and not Omicron. And so until that sort of transition period happens, it's a little bit difficult. It's a little more difficult to get the modeling on that. So we're watching it very closely. We're in regular contact and consultation with our modeling team, and if we need to make any changes to alert levels, we will based on that information.
Our next questions are from Henrika Wilhelm with the CBC. Please go ahead.
Hi, so my first question is that, you mentioned the increase in demand for testing, and you also mentioned that there are changes to contact tracing, that people have to notify close contacts themselves. In how far is that and the outsourcing of testing an indication of public health being stretched?
So I think we're trying to be as efficient as we can and as effective as we can. And so we're using all the tools at our disposal to be able to get the information that we need. These are, contingency plans that we've had. And so we're at a point now where we need to bring in those contingency plans. So I don't think it's a secret to say that public health, certainly, we're getting case counts that are getting beyond the ability to do individual contact follow-up and management, and that's why we've had to go this route. But that doesn't mean that what's happening is less effective, and it doesn't mean that we're not able to do what needs to be done. So the information that you get, if you are notified as contact, the information that you get in that letter is no different than the information you would get from a phone call from public health, and it carries with it the same weight and the same requirement to follow the isolation instructions. So these are the methods that we would use in times of surges such as we're seeing right now.
And Dr. Fitzgerald, I think it's safe to say that we haven't reached our testing capacity limits just yet.
Nope, not just yet.
And then I was also wondering, we spoke about the booster vaccine, and I believe Minister Haggie, you mentioned the factor 5, and you also said that there is enough, there's no shortage of supply, there's enough Moderna vaccine doses available. Yet it seems that a lot of people can't get appointments and just, can't find a booster shot. So why does it seem that there is such a delay and wait in the administration of boosters?
I think the issue with the boosters is simply the demand. It has been extremely good. The help from the media and CBC and VO. We are painting more clinics and we are redeploying staff from other duties. In actual fact, we're looking at a likely delay for resumption of elective surgery after the new year to allow those staff to be redeployed to provide boosters. And obviously there's a testing demand as well. So we're trying to enlarge the pie of staff to allow this to proceed. Vaccine supply is not the issue. We're working with the regional health authorities to try and get both testing clinics and vaccination clinics out in the more peripheral rural areas. But again, the last 4 days have been a challenge because it is traditionally a holiday time, and these are the same people who did this last Christmas and have been at it since March of 2020.
I would just add too that there's been an incredible response from healthcare professionals across the province putting their hand up to volunteer to go into these clinics. And we have done it at record pace. We thought we had a good record before in the summertime at around 6,000 a day, and we've exceeded that and continue to exceed it. And a big thank you to the regional health authorities, their leadership teams, and everybody, doctors, nurses, former doctors who put their hands up, allied health professionals put their hands up to help give the vaccines. So we're getting there, and we're on the right track.
Our next questions are from Heidi Adder with CBC Labrador. Heidi, please go ahead.
Hi, thank you. You said more testing kits are en route, but people were turned away after those provincial airline flight exposures. Why didn't you make sure there were non-expired kits in Nunatsiavut for testing, especially as weather dictates flying and kits could have been sent up before the weather was bad when island cases were increasing?
I think you make a very good point. We don't have a crystal ball. We did actually go to the federal government back in April, May of 2020 to ensure that Newfoundland and Labrador were both treated as rural and remote to deal with simply that issue. We have ramped up the supply and unfortunately there has been a bit of a lag in some areas, but we've worked very closely through Labrador Grenfell Health with NG to support them and to provide whatever assistance we can, particularly in the form of the tests. So, we had a surge and the surge was greater than we predicted.
Now here in Happy Valley Goose Bay, people have been waiting in that drive-through testing site for 6 hours, then turned away yesterday evening. Why has this been happening instead of having longer testing hours like you do in St. John's or other places on the island?
My indication from Labrador Grenfell is that is to a staffing issue. This is the same people who are involved in contact tracing and in vaccination. So again, it's been a challenge for Labrador Grenfell over the holiday period when nurses and healthcare providers who are not scheduled to work are looking for time with their families. As the Premier said, volunteers have stepped forward, but the demand is significant and they're working their way through it.
I will now go back through each reporter to see if you have one final question. Richard Duggan with VOCM, do you have a final question?
Yes, I do. It was said at the start of this briefing that we're currently in the middle of an Omicron wave, but of course, the Delta variant is still in our midst. Do we know how many of our current cases are Delta versus Omicron?
So right now, very few of our cases are Delta. The vast majority are Omicron. We had some Delta that were, there was an outbreak in Western that was going on just as Omicron started to come to become more prominent, and we have seen a scattered few travel cases that are related to Delta, but the vast majority right now are Omicron.
Peter Jackson with the Telegram. Do you have a final question?
Yes, I do. Thanks. I'm wondering whether COVID alert codes are still being issued to people who test positive, or have we basically abandoned that route?
The federal government gave up on COVID alert app some time ago, several months before Christmas, in actual fact. They've stopped supporting it, and they've stopped updating their dashboard. The uptake was so low that the effort to maintain those sites was unreasonable, given the fact it was yielding so little. I can check on that, Peter, for you. I honestly don't know, and we'll certainly go back and try and find an answer for you.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
I do. Quebec, in Quebec yesterday, it came out that the province had decided that healthcare workers who are infected with COVID-19 will stay on the job because of the pressures put on the healthcare system there. We've seen rapid rising of hospitalizations in other provinces. What do you make of that decision by the Quebec government? And would you, if we saw a similar sharp rise in COVID cases here and hospitalizations here, would you ever consider doing the same thing?
Well, all of us could probably answer that question, Patrick, but this is the reality of the Omicron. It spread so quickly. Certainly, we had a little bit of a lead time in boosting, as Dr. Haggie said at the beginning, our healthcare professionals, and we're hoping that is going to provide a robust layer of protection. Obviously, we will be judging things accordingly and moving as the evidence changes, and as we've seen in the past, this can change very quickly, and we'll have to adapt and change with it. But right now, that there is a healthcare worker protocol in place. If you're a close contact or if you have tested positive, it's not our intention to change it at this particular moment in time. But we're also interested to continue to look what the federal government does and what Dr. Tam and her team do with respect to the change in the CDC guidelines recently, which I'm sure you're aware of, changing the isolation period from 10 to 5 days as well. So Quebec had to do what they had to do. That hasn't had to happen in other jurisdictions, but we're certainly mindful of the pressures on the system. Dr. Fitzgerald, I don't know if you have anything further there.
No, not really. That sums it up.
Ben Cleary with NTV. Do you have a final question?
Yes, I do. Thank you. My question is for Minister Osborne, and that's just what's your message to parents and guardians today who are now stressed about that January 4th date and will have to manage online learning while being expected to work?
I know that this change, anytime there's change, it can bring about some anxiety. And, we understand that this is obviously not the preferred choice. The preferred choice for government and our school districts is that we have in-class learning. It's better for our students, it's better for their emotional and mental health. But because the Omicron variant is spreading and can spread so quickly, public health and government have made the decision in the protection of our school communities to have virtual learning. So this will be evaluated on a weekly basis. We will provide an update again this time next week. As quickly as we can get our students back in class safely, we will do that.
Henrika Wilhelm from the CBC. Do you have a final question?
I do, thank you. So I just wanted to ask again about the gatherings over New Year's, especially now. I know you said just because something is permitted, it's not necessarily risk-free. 19 people can still gather over New Year's. How concerned are you that this is the perfect environment for more spread of COVID-19?
So with regard to this variant, I think any, if you're getting together with people, there is that potential for spread. And we're not saying that gatherings should be up to 20. We're saying that you should stick within your consistent 20 contacts. So your gatherings should really be as small as possible. And that if you're getting together, it should be with those close, consistent 20 people that you're getting together with, and that not everybody in your consistent 20 contacts will be contacts of each other. So you have to consider that as well. Certainly we encourage gatherings to be as small as possible, and that you practice all those same measures that we've talked about all along, that you don't go if you're sick or if you're isolating for any reason, that you make sure you wash your hands well. You can still wear a mask if you're in mixed company. All of those things can still help to prevent the transmission of COVID in those situations.
Heidi Adder of CBC Labrador, do you have a final question?
Yes, thank you. Coming back to Labrador for a moment, how long does it take to get test results back to people in Labrador versus the rest of the province? As people in Nain, for example, are waiting to find out if they're positive, or there's hundreds at the local drive-through testing site. How long are they waiting to hear back if they're positive or not?
I can't
So
give you. Sorry, Janice.
Sorry. So if they're getting a rapid test, they'll know in a very short period of time if their rapid test is positive and what we're calling a presumptive positive, so that they will get very quickly. Certainly if they're having a PCR, then we have to factor in transportation to and from Labrador, and that can be affected by weather. And then the turnaround time at the lab. Which is, it's less than 24 hours, but it does take several hours for the result to get done at the lab once it's received there, if it's a PCR. We are looking at ways to expedite that process and to reduce that turnaround time from time of test being taken or swab being taken to the test being completed for Labrador.
But it's safe to say, Dr. Fitzgerald, that's the reason why those rapid test kits were deployed to those isolated communities through these logistical chronological issues that exist throughout the province. So strategically, that was considered in the deployment of those rapid test facilities and kits to communities like Nain and the coast of Labrador.
Yes, that's right.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us today. And as you can see from Dr. Fitzgerald's report today and in the numbers last week, we will see more in the days ahead, unfortunately, more high numbers. I'd like to make sure people are also following the hospitalizations and the ICU capacity as we try to extrapolate from other jurisdictions. Please don't partake in rumors. Please listen to the public health advice and what's being published on our behalf. And please keep up your own collective line of defense. Keep your contacts low. Make sure you book your boosters. Continue to follow the public health and safety guidelines. And again, avoid adding to the rumor mill. 2022 is just around the corner. 2021, as Minister said, was better than 2020, and 2022 will be better again. We have more tools in the toolbox to fight this battle together. So we will get through this, Newfoundland and Labrador, together. Be kind and be safe. Thank you.
Thank you, Premier.